to prepare for potentially a second wave and to ensure that we can maintain services at the same time, mitigate the effects of COVID-19 to the greatest extent possible. I'd like to end my comments by thanking those healthcare providers across the province and physicians, and also to the people of the province who continue to do their part to fight the virus. Simple actions like wearing a mask, washing your hands, and staying home when you're sick all helps in containing the virus. And we cannot do our jobs as providers without your help. Especially as we move forward in the fall and continue to strengthen the testing and contact tracing capacity, this support will become even more important. So please do your part and stay safe.
Good afternoon. Over the weekend and including today, we're reporting 56 new cases in 3 days. These cases are predominantly in Southwest and West-Central Saskatchewan. The Ministry of Health, Health Authority, and the Hutterian Safety Council are working together to address this. This includes increased testing and contact tracing in affected communities, ensuring those who test positive and their close contacts self-isolate, raising awareness in those communities about good health and safety practices to protect yourself and those around you, and ensuring compliance with self-isolation orders. I should note that the 2 Hutterite communities in the RM of Maple Creek that were the site of the initial outbreak are down to a very small number of active cases. So these actions do work to get the outbreak back under control. Starting today and in the weeks to come, Saskatchewan residents will have access to additional everyday health services. This marks the beginning of Phase 3 of the service resumption plan the Saskatchewan Health Authority announced back in May. Services that will resume in the next phase include further enhanced mental health and addiction support, including the openings of social detox and addictions inpatient treatment, additional chronic disease management, wellness programs, stroke prevention, and specialized services for clients with developmental disabilities, autism, and brain injuries. As well, in this next phase, we'll continue to expand surgical services across the province, returning to between 75% and 85% of our pre-COVID volumes. Some areas of the province are seeing surgical volumes in excess of this number. For example, in Moose Jaw, the FH Wigmore Hospital is achieving beyond 100% of their pre-COVID surgical levels as a result of new surgeons that were recruited to the community. Reducing that backlog further remains a key focus for this government and for the Saskatchewan Health Authority. Diagnostic imaging services will also continue to increase. However, they are currently performing at 90% of their pre-COVID service levels overall, with MRIs at 91% and CT at 93%, for example. This is a great accomplishment due thanks to the hard work of many. Today, we're also announcing that effective Tuesday, July 14th, Saskatchewan will move to a universal testing model for COVID-19. This means COVID-19 testing will be available universally to anyone who requests it, regardless of whether they have symptoms or not. Patients are encouraged to contact Healthline at 811 to arrange for testing. This move supports our earlier commitment to increase testing capacity in the province because we know the more people that get tested, the more quickly we can take action to protect others. I'd now like to ask Scott Livingstone to add a few comments. Scott?
Thanks, Minister. Again, I'd just like to acknowledge that I'm joined today by a couple of Saskatchewan Health Authority colleagues, Dr. Rashad Hansi, our Physician Executive for Integrated Urban Health, and Dr. Jessica Minion, who's one of our lab experts. Both will be available to answer questions in just a few moments. I'd like to begin by thanking our healthcare workers who have been working hard over the first 2 stages of service resumption since May 19th and continue to support us now as we enter the 3rd phase of service resumption, and at the same time maintain our response to the COVID-19 pandemic. As Dr. Shahab continues to say many times, that this is less of a sprint and more of a marathon, and we will continue this new normal for some time. Today, if you look online at the Saskatchewan Health Authority's website, you're going to see since May 19th, when the first phase of service resumption was announced, over 544 services have now resumed across the province. Overall, we're pleased with our ability to bring these services back online safely and quickly, but we are still implementing strategies to keep patients and providers safe throughout service resumption. So far, patients and their families have been extremely understanding of the additional criteria, screening measures, and changes relative to how they have traditionally received service. We also know that many patients are anxious and awaiting their further resumptions of services to address things like elective surgery and other clinical face-to-face meetings. As the Minister has indicated, starting today and in the weeks to come, we will continue to expand service offerings to further everyday healthcare services for people across the province. And while we know our providers are eager to return to their new normal, I must stress that services coming online are being done as quickly and as safely as possible. I've also mentioned before that we've recognized that dealing with COVID-19 for some time, we also have to ensure that our pandemic response maintains a focus for the SHA, including allocating staff to our various pandemic response areas, including testing and contact tracing. This has been particularly important as we see increased caseloads, such as the ones in the Southwest, but also the cluster of cases in Prince Albert. Maintaining that capacity to respond will be an ongoing need for us as we wait for a vaccine. I'd also like to provide a quick update for folks on the efforts to support virtual care delivery in Saskatchewan. We know that face-to-face care with a provider, cannot be completely replaced through the use of virtual care. But since March, with the expansion of this offering, we have seen it minimize some of the slowing downs of services, but also provide another avenue for patients to make contact with their clinical providers. Since initiating the expanded virtual care options as the result of pandemic in March, more than 175,000 appointments have been delivered through this option. Virtual care delivery was fast-tracked in a major way over the past few months and has, as I said, helped been able to tap into potential for virtual care in the months and years to come with respect to innovative ways to provide more services to Saskatchewan people across the province. With respect to testing, as the Minister has already indicated, as of tomorrow, July 14th, COVID-19 testing will be available at testing sites and assessment centres. Today, our laboratories are processing approximately 600 COVID tests per day, but we have daily capacity of around 1,800 per day. By calling Healthline 811, patients can be triaged and sent to the most appropriate testing centre. Just a heads up or a note that the time between requesting and receiving a test may vary per individuals, as we are still placing a priority on those that are symptomatic or those individuals that have other risk factors, such as those patients who are immunocompromised receiving cancer therapies. With this new change, we'll be watching the numbers closely for testing and ensure that we can respond to the needs that are out there as we prepare to further increase our testing capacity near the fall of this year to prepare for potentially a second wave and to ensure that we can maintain services at the same time, mitigate the effects of COVID-19 to the greatest extent possible. I'd like to end my comments by thanking those healthcare providers across the province and physicians, and also to the people of the province who continue to do their part to fight the virus. Simple actions like wearing a mask, washing your hands, and staying home when you're sick all helps in containing the virus. And we cannot do our jobs as providers without your help. Especially as we move forward in the fall and continue to strengthen the testing and contact tracing capacity, this support will become even more important. So please do your part and stay safe. With that, I'd like to open up the floor to questions.